Next, we're going to go deeper into the cerebral vascular access policy and the pain management policy. Again, here's Dr. Jocelyn Freeman-Garrick.
A major change to the cerebral vascular accident policy for 2010-2011 is the transport time for a patient who has an acute ischemic stroke that was last witnessed normal. Prior, you were operating under a 3-hour window. Now it's 4 hours. And that's because the American Heart Association stroke guidelines in 2007 were amended to last witness normal 4.5 hours. They're finding that patients who receive thrombolysis within 4.5 hours have good outcomes. Because of that, all of our certified stroke centers by Joint Commission operate under that mandate. So we are amending our policy. If a patient, when you arrive to their home or to the nursing facility, was last witness normal in less than 4 hours, they should be transported to a certified stroke center. EMS is often asked, well, what if they present 5 or 6 hours after? Or what if they woke up with the symptoms and they were last witness normal the night before? They don't meet criteria for immediate transport to a stroke center. They should go to the closest hospital or receiving facility to get intervention. What's imperative for the stroke centers and for you in the field when you arrive to a patient's home or facility who meets criteria for acute ischemic stroke is to document the history and last witness normal. All of you, when you arrive to the scene, are doing your Cincinnati pre-hospital stroke scale. And if they meet criteria, then you call the Certified Stroke Center. They're activating their stroke teams while you're in the field, so they'll have all the personnel in the hospital. But what they need to know is the last witness normal. If there's a significant other or family member at the home, please ask them to follow you to the receiving facility where you're taking the patient. They need to know all the other medical problems that the patient has, and that historian is pivotal to the care that the patient will receive. The pain management policy for this year is also being amended for adults and pediatrics. Currently, the policy reads to contact base if you want to administer pain medication and your transport time is less than 10 minutes. You all know that you can have a child who has an acute fracture or someone who has chest pain and your transport time is only 5 minutes. The last thing we want to do is withhold pain medication for those patients. So liberally give medicine, do not withhold. There's no more limit that you have to call base if you have a transport time less than 10 minutes.